Welcome to the Dr. Lamb Show. We have Nat Kringkudis with us, who's a two times best-selling author. And she also has her own podcast about women's health and natural fertility. She did find the Melbourne's Home of Natural Health Clinic, including has helped over 20,000 women rescue their hormones. And we're going to be talking a lot about sexual and reproductive health, even whether the birth control pill is good for teenagers or not, and what to do for irregular periods. And so she's been educating and empowering women to take control of their hormone health and to ditch the stress. And we're so excited to be able to talk to her because we deal with a lot of women too who's been under a lot of stress, and they always have the same hormone questions. So welcome, Nat. It's great to connect with you today.
Thank you. Thank you so much for having me. It's a pleasure to be here.
Yeah, so we connected by doing another summit together. Actually, it was like a breakout for burnout, right? And so stress is
Mm.
a huge thing that we deal with. We both deal with, and you're all the way down under in in Melbourne, but here we are able to help the world, right? So why don't you just tell me about how you got into integrative medicine, where you've come from, and why you're
Yeah,
dealing and doing
I
what you're
would
doing
love
now.
to.
Hmm.
Yeah, I would love to. I started in clinical practice. My background is Chinese medicine around 16 years ago. And at the time, I mean, things were very different. I think nowadays we accept that our signs and symptoms are often a direct reflection of our environment, or at least we're starting to accept that this is the case. But 16 years ago, more than 16 years ago, we didn't have this correlation. And I just happened to have this influx of women coming into my clinic that wanted help with their fertility. And truthfully, I didn't know how to help them. Their doctors didn't know how to help them. Nobody knew why they were experiencing all these crazy symptoms, especially fertility and not being able to fall pregnant. And so I didn't want to treat fertility. I didn't want to treat women's hormones. Hormonal women are crazy. I mean, I'm a hormonal woman. I know what that's like. And so I really resisted. I was like, no, no, this is not my thing. Like, I just want to really treat, I want to treat gut health. It's nice. It's in a little box. But over time, we just had more and more women wanting answers. And so I decided that whatever I'd learned at university, whilst it was a great foundation, it really didn't provide me any clues into modern day conditions. And
Right.
to really go on a path to help these women get answers as to what was going on. And was when I was writing my first book, Well and Good, which is a fertility guide. I just had this epiphany. I was like, we need to fix this before it's broken. We're treating 30 something year old women and educating them then on their fertility. And some of them didn't even know what ovulation or a menstrual cycle even meant. And what about if we were talking to the 18-year-old or the 16-year-old at the point where they were maybe being diagnosed or recognizing that they had horrible symptoms associated with their hormones? And so that's where my passion really lies nowadays, in educating women in general, but especially young women, to have that
Mhm.
information so that they can make informed choices for their health long term, not just in the moment.
Yes, I love that. A lot of times we kind of pun it to the schools, like maybe sex
Oh,
ed or
yeah.
something like that, right? But no, like even parents are kind of uncomfortable about talking about this, or doctors might also not really bring it up with teenagers in the doctor's visits,
Well,
and
I think the challenge there is that, in a clinical situation, especially for a doctor, there's not a lot of time to sit there and discuss that. And it takes time to learn that about yourself. So it's not anyone's fault, especially as us as mothers. If we were never taught this, then we can't pass on that wisdom and information. And a lot of us don't know it about ourselves because we were prescribed the pill at a really young age. And that was for whatever reason that might have
yeah,
been, but it means that we've never really had to have that conscious awareness and then
yes.
information that our body's always feeding back to us. But also, a lot of parents just don't want to talk about it. It's not their thing. They're not
It's true.
confident in talking about it. And so I think the conversations still need to continue. It doesn't just go away. In fact, it's it's a lifetime of
Yes.
learning about ourselves.
Yes, that's true. So, when do you think we should start talking to our children or grandchildren about their sexual and their reproductive health,
Yeah,
especially
it
women?
I know, right? It is one of those things that can feel quite uncomfortable. And I think the reason is because we don't talk enough about it and we don't talk truthfully and factually about it. So, from a very young age, I think it's appropriate to talk about when children start to ask the questions, and it's always going to be with an age appropriate answer. But
Hmm.
when our children start to ask the questions, where did I come from? How was I made? And we can answer that truthfully, and we don't really need to feel ashamed about it. And this conversation just evolves over time. So if your 4-year-old is asking you, how did I get in your tummy? You tell a 4-year-old, mum has eggs, dad has sperm, and they need to come together for conception. A 4-year-old, most 4-year-olds will be, oh, okay, that
Uh-huh.
makes sense. And
Yeah.
and be done with it. And then maybe in a few years' time, they might have some more questions about it. So that by the time, especially for a woman, but also for men, by the time they start to develop and go through puberty, they've got this understanding, and it's not this bombshell that you drop on them the minute that they start to show that they're transitioning. But they already know that, they're not ashamed about it, and it's been this conversation of evolution, just like anything else. And I think if
Right.
we do that, we take a lot of the fear and the mystery out of it and really
Mhm.
empower from a very young age.
Yeah, so it's just like when they're growing, they go through puberty, they have a lot of physical changes, but in that can also be a lot of education, right? About what the changes mean and how it affects each person's body, right?
Absolutely. And like I said, we have an emotional attachment to our sexual experiences. They haven't had that yet. So they're not even thinking in the same way that we are when it comes to even talking about sex. They only
Hmm.
want the facts, and they're not normally they're going to respond via how we are talking about it. If we're talking about
Right.
it in a way that's taboo or scary or
Yes.
dirty or whatever we might have those associations with, they're going to look at it in the same way because they don't know. They're going to just follow our examples. So I think
Right.
just having that slow conversation and not being mistruthful, like where did I come from? We've been told all sorts of things. The stork delivered you, the doctor put me there, which might not be untrue depending on how you were conceived. But
Yeah.
I still think having that fundamental 101 is really, really crucial to changing the landscape of women's health in general, and our
Right.
sexual health across the
And
board.
if you think about it, if we as parents are not telling them, they're going to be getting it from outside sources,
Oh,
right?
yeah.
The media, it's inevitable. So it's like if you want them to know the truth, you should be the one telling them.
100%. When we were writing our last book, Beautiful You, um, we surveyed women and daughters and asked a lot of questions. And we asked, were parents satisfied with what their children were being taught when it came to sexual and reproductive health? And it was something like 89% of parents said no. But then we also asked the younger generation, the daughters, where they were getting their information from, and the majority were Googling it. And that's a slippery slope because unfortunately, 9 times out of 10, you'll end up on some porn site that creates some type of unrealistic expectation of what a first sexual encounter might look
Hmm.
like,
Hmm.
all because we're not having these conversations. So I think we have a responsibility, and I think we know
Hmm.
that, but we still don't feel comfortable talking about it because we were never told in that way.
Yeah, yeah. So it's great to start being open. That's the first step, right? And educating even children, but even people nowadays who have issues, who don't have issues. So talking about issues, even teenagers, when they start getting their periods, it might be irregular or it might not be what they expected, or your mom had it this way, but how come I'm not having it this way, right? So there's a lot of questions about what to do about the period, and one is very common question is what to do if a teenager is missing their periods, they're getting more irregular. What do
Yeah,
you think?
definitely. I think we tend, and as mothers, if our daughter's periods become irregular, we can panic. And it's not that we shouldn't explore what's going on, but we need to consider what's actually going on. And I think too often we just look at the symptom, and then this is, as we were speaking just before, this is often how we end up on birth control as a result of panic when we haven't looked at the reason why something's happening. And so I will always say, and I talk a lot about teens and the use of the pill. And I'm not here to say what's right or wrong for you. But I think just having the information to be able to stop and ask the reasons why something might be happening to our daughters. It's one thing to use the pill for contraception. And if that's a conscious choice and you really are informed and you understand that, then that's totally fine. But that's not often the case. And then if we're using the pill to treat an irregular period, let's say, or a painful period, or acne, or PMS, or there's so many things that we would use the oral contraceptive pill for, and not
Mhm.
looking at the underlying reason why, then that can be a really slippery slope as we get older, because we haven't fixed the problem at hand. And there are a lot of common and very normal irregularities that happen in teenagers that we look at it as an adult and think there's something wrong. But a woman isn't sexually mature in terms of her hormones until she's around 21. So it's really common to see these fluctuations, and we don't necessarily need to panic, but we do need to consider, okay, A, is something changed? Perhaps heightened stress and pressure with school. So really common for a 16 to 18-year-old
Yes.
to have a lot of changes when it comes to pressure and the load, their school
Mhm.
load, their workload. They're trying to combine a lot of things. Life becomes pretty stressful as a 16-year-old. And we laugh about it. We go, oh, to be 16 again and have these problems. But the reality is that they're often experiencing these problems for the first time. And so they feel
Mhm.
really big and really heavy and really stressful. Um, and by not creating a safe space to talk about it, it actually has an impact on our sex hormones, because our stress hormones and our sex hormones are constantly competing for
Yes.
balance. So I think that's really important. I talk a lot in the book about the changes of a 16-year-old's hormones and how they do go through a phase that very much mimics PCOS for a short period of time, which means we see a little bit of weight gain, we see body shape change, we can see acne, we can see
Mhm.
period irregularities. And it's not a cause to panic, but it is a cause to observe and see if there have been changes. And if there haven't, I would still continue to observe that over a couple of months. A few months of observation isn't going to be your child's undoing in terms of their health.
That's
Um,
true.
the other thing I do want to say is often teenagers are put on the pill, and like I said, we sexually mature around the age of 21, give or take, for women. And if we're using the pill at a really young age, we're stopping that maturation from happening. So if we're putting a 14-year-old on the pill, when she's 28 and she transitions off, she's as sexually mature as a 14-year-old. So it takes time to
Yeah.
reestablish that connection between the brain and the reproductive organs. And I don't think we know that. And I think if we did, we would actually stop and look at other solutions first, perhaps.
Mhm.
And I think that's really important, because I see the women that are 35 wanting to have children, transitioning
Mhm.
off the pill and going, I just thought that that was fixing everything, only to
Mhm.
discover that they've got the same problems, if not worse, when
That's
they've
true.
come off the pill. So I think it's not that the pill's the enemy, but the longer that we can wait to use it, it appears to have less of an impact on our hormones long term and
Yes.
less problematic the older that we are, or the closer to we are to that age of 21. So we
Right.
also, it means that we don't get to understand our bodies as well. So there's so many reasons why I would just say take a breath, wait, really work out if that's the right thing. And if it is, then that's great. We've got so many options, but it's just not always a solution at the time.
Yeah. I love, let's just recap what you said. So, number one, that yes, when you have irregular periods, that it can be normal, especially when they're transitioning as a teenager, right?
Mm.
That it becomes irregular. Give it a few months of just checking it out and seeing, hey, what could be the root cause, right? In integrative and functional medicine, we really try to see what is actually causing these symptoms. Irregular periods is not, it's not a disease in itself, right? It's really like it's a symptom of your body is telling you, hey, maybe it's the stress, or maybe it's the hormones that are off or imbalanced. You need to start looking at that, right? um, and so getting to the root cause of the hormone imbalance is very important. And for teenagers, what can cause hormone imbalances, like you said, one is stress. Two can be sometimes they are over exercising also,
Mm.
right? And or three is they have a bad diet and lifestyle, and a lot they get exposed to a lot of xenoestrogens, whether it's in makeups or in pesticides or in the foods that they're eating, or the chemicals or the cleaners is kind of just everywhere. And it can really disrupt our hormones nowadays, especially young girls. And even the foods, I don't know in Australia, but in America, right, the cows are fed with lots of hormones. And if you eat a lot of non organic meats, that hormones are going to go into our bodies and also disrupt our own hormones. So that's why we're seeing teenagers earlier and earlier just getting their periods uh, like at age 10 or at age 11. Is that what you see in Australia?
Yeah. Yeah, the average age for us used to be around 13. The
Mm-hmm.
average age now seems to be slowly creeping more towards 11. The other
Mm,
thing that I see a lot of nowadays is early puberty or precocious puberty, and looking at the reasons why that might happen. And so I think you're 100% right. There's so many factors that are weighing in as to why we're seeing the adrenals respond to the environment earlier and earlier and really
mhm.
instigate the puberty from an earlier age. And so,
Yeah,
again, it's a modern
yeah.
lifestyle issue, and it can be a hard pill to swallow when you think, oh, you're telling me that my lifestyle's doing this, and it's
Hmm.
like, yeah, you're responding constantly to the environment that you put your body into. So,
It's true.
like I said, there's a lot of changes, a lot of pressure, and life isn't quite as simple as what it was for us as kids. Kids
Hmm.
are overscheduled, like you said, often over exercising. Um, and that's kind of just like it kind of is the same for every child. So we
Hmm.
have to
Hmm.
weigh that up and look at how can we balance that out if we are
Yeah,
making conscious choices and being really aware around all of this. That's where it
yeah.
starts. It just starts with being conscious.
That's true. And then what you also did bring up is that a lot of times the pill is given for the wrong reason. It's
Mm,
to cover up all these symptoms, right? Rather than trying to really say, for birth control. That's what it's supposed to be for, birth control. But it is unfortunate that we don't have anything else. That there are other options for birth control, but they're not as efficacious, efficacy to 98.9% like as the
yeah.
pill. And so that is an unfortunate, but making sure you're doing it for the right reason, like talking to your doctor about it. Is this truly necessary? Because now, especially in adolescents, more and more studies are coming out that the pill actually has higher risks of adolescent depression and adolescent suicide. And birth control pills can even cause more insulin resistance all the way throughout, even into menopause. You don't even know, but birth control pills has that long-term effects, right? Even if you took it only when you were in your 20s or in your 30s, it's still affecting you in your 50s and your 60s. And
It would be so nice if there was that one thing that's a solution. And we all want the one solution. And I think
yes.
that to a lot of people is what the pill looks like. It's like, oh, the one thing that I can do for all of these problems. And look, I often say to patients, if you're having horrible periods and you need a break and you need a chance to kind of that if that's the choice that you've made, still let's come in and sort everything else out. And then we want, long-term aim would to not have to rely on something like that. But
Yeah.
I think often, like you said, we want a solution, and our mothers want the best for us, and so it's I think it's too readily and quickly prescribed without having those conversations.
Mm-mm. So yeah, talking about the solution, what do you think is important to really help people out nowadays with this? If they're dealing with this issue and they don't want to go on a pill, or they're having, like you said, maybe irregular periods or the cramping or some of these other symptoms in their periods.
Yeah, I think really assessing, like I said, the situation. And I think one of the best things we can do for our younger girls is teach them how to understand their menstrual cycle. And that really does require us to track that over several months to have a look at it. But what a gift that can be for you to understand your cycle. And once you understand it and you can look at where and profile your symptoms, you're going to know if your symptoms are hormonal because they'll be cyclic. You'll have them at the same time each month, whether that's the middle of the cycle or the end of the cycle and those peak hormone times of ovulation and then menstruation. So I think, first of all, observing becomes really important because if you're just getting random headaches, you know, for example, and they're at any time, they're possibly not hormone related. And so you may choose a different track or path with that. So I think it's important to really observe, and it's such a gift to be able to do that. to teach a young girl how to understand what her body's telling her every day of the month. So I think
Mhm.
awareness is the first thing that we really need to be mindful of. And then secondly, you've listed a lot of those things. I do think that we generally accept now that lifestyle, nutrition, environment, so all those things you've spoken about in terms of chemicals in our body products, in our cleaning products, in our, environment around us, our nutrition. I think that is all extremely important to profile and look at too, and making sure that we're having the enough nutrients in our food that you can't out supplement. You never can out supplement, but it might mean that because of whatever your history might be, that some supplementation can be a good idea, and speaking to the right person to understand that can be very useful. I'd say if something goes on for more than 3 or 4 months and nothing has changed, and you've profiled all those other things, then it's a really good idea to go and seek testing from your healthcare provider, to have a look at if there's something else that might be going on. But I really think the one thing that we don't pay enough attention to is emotional health and emotional stress. And so if we're not looking at that piece, that's often what's missing. You can
Mhm.
you can eat all the nutrient dense food on the planet, but if you've got this elephant in the room
Yeah.
of something else that's impacting you, and that's just another stress, all these things we're talking about are stresses really at the end of the day, then I think you have to go down that path. You have to look at emotional health, and really that's a big feeder for hormone imbalance. So I think having all that in mind, the one other thing I will say is that family history tells us a lot as well. So looking at our mother and at me as a mother and my daughter, looking at what I'm predisposed to, and you know using that as a blueprint, not saying it's 100% going to happen, but if you have a history of, say, polycystic ovarian syndrome, then I would be doing a lot of things to make sure that that doesn't really get turned on for our next generation.
Yes.
You can be genetically predisposed to something. It doesn't mean that you ever have to get to a point where you have a full-blown condition or syndrome. So
Mhm.
it doesn't mean that you don't have the ability for that to happen. For example, I think eczema and psoriasis are two really great examples that people can identify with when it comes to this. I have a history of eczema, but I haven't had eczema for 20 years because I do so many things to make
Yeah.
sure that that doesn't become a factor for me. And again, PCOS or endometriosis are the two common things that we see. It
Mhm.
doesn't actually have to present if we can put ourselves in the right environment. So
Mhm.
using that blueprint of the parent, or the even just the family, the sisters, or it's all in the gene
Yes.
pool, it's all in the mix. So I think that's important to have that and use that tool to
Yeah.
help to just another piece of the puzzle.
Yeah, and not also on the other side of that is not blaming your genetics, right?
Oh, no,
Because
right,
like you
totally.
said, it's like nature and nurture, but you have the genetics, but you can decide to turn it on and off using epigenetics, and that's the environment that um, tries to affect the genetics. And so, like you said, like the mom might have had endometriosis, but a daughter might have predisposition to it, but we can mold her environment to not present itself based on the lifestyle changes that she makes. And one thing that I really like that you also brought up was that the adrenals, right? People don't really think about the adrenals, and that's one of our expertise in dealing with the adrenals, because your reproductive organs, sure, they make estrogen, they make progesterone, the hormones that you need, but your adrenals also make those hormones. We forget that your adrenals have to make the DHEA, progesterone, testosterone, estrogen, and it all has to be in balance. And your adrenals also make the stress hormone cortisol, right? And so if your adrenals are thinking, hey, I'm stressed, I'm going to make more cortisol, then maybe less of it will be going to your reproductive organs. And so therefore dealing with the stress is also super, super important. I love that you brought that up. Okay. And so kind of transitioning from teenagers, how does this kind of look in someone who's in their 30s or their 40s or even going into menopause? Like, what can we start doing for them?
Yeah, I think looking at our signs and symptoms as clues and not sort of some type of death sentence is important. We love to blame our hormones, but we don't really know what it means. We love to, we'll say, "Oh, you're so hormonal," or "I just feel hormonal." Well, what does that
Yes.
mean? Like, so
It's
I
when you
think
start having a pile of tissues and you're just crying.
right, but we don't, we don't really explore that. So I think using your symptoms as clues, and I say your body's always talking to you. It's just a matter of being able to listen to what it's saying. And if we can't listen to what it's saying, then that's when we end up often medicated when we don't need to be. So I think observing over time what's actually going on for us is extremely important and no different. Our symptoms are sometimes louder and we've had them for longer as an adult. So we have more of a picture of our long term health and the landscape of our long term health as women. So, really utilizing those clues. What is my period telling me? Is it light? Is it heavy? Is it on time? Is it late? Is it early? Like looking at all these things, I think helps us to be able to work out, and look at those clues. So, I think that for me is always where I get women to start and really profile those clues. And on my website, I have just a really easy 101 hormone worksheet that you can it's it's actually so basic, but we get so much feedback on it because it means
Mhm,
you can go and kind of profile what your symptoms look like, and it's not going to give you a definitive answer,
mhm.
but it's going to allow you to become curious as to what does that actually mean, or now what do I do next? Am I estrogen dominant? Am I testosterone dominant? Am I deficient in certain hormones? But your symptoms will tell you that very, very quickly. And then it might mean you stop and think and go, you know what, I've had heavy periods. They've been quite problematic. I don't feel good before my period. What does this actually mean? Maybe I actually need to go and talk to somebody to get that checked out. Or maybe I could just check in with my stress levels for a moment and see if that's having an impact, which it, by the way, always is.
Mhm.
And so looking at the wider picture, I think, is important for us as women.
That's great. And definitely give us that link and we'll put it down below in the comments so that if people can definitely check out that resource to know which, maybe like a quiz, to see which hormone is dominant or not. So it's been really great talking to you, not only about to balance hormones, how the pill might not be a really good solution for teenagers, and really trying to get to the root cause, and why it's important to start this conversation early, right? Is there anything else you'd like to add?
No, I just think never second guess your symptoms. They're there to tell you something. Often we, as women, we put ourselves last in the family if we're the mother of the family. Um, you know, being able to address this at whatever age, phase, or stage you are, it is really important. It's never too late to do that. But I think as mothers, we often do put ourselves last, and we really can't be much to anybody if we're really running from that empty space. So it's not selfish to put yourself first. It's actually doing
I
the
love
right
that,
thing for the rest of the people in your life.
for sure.
And if you do find yourself with symptoms, then definitely start to explore and become curious as to what they might be, just so you get to enjoy your life as well.
That's true. This topic is not only for the teenagers, but it's for the mothers that are taking care of the teenagers, right? The
Yeah.
grandmothers who have gone through menopause. And the same idea stands is that the pill is not, or even just hormones themselves are not the right idea or the right solution unless you get to the root cause. And it's always important to really find a practitioner who understands what you're going through if you've been dealing with the symptoms and you're not feeling better. And that's what Nat is doing. That's what we are doing, in trying to get down to the root cause. So Nat, how do people get a hold of you or find you? What's the best way?
Yeah. I'm Nat Kringoudis everywhere, natkringoudis.com and Nat Kringoudis on all social handles. I love hanging out on social media, and I'll often have many conversations there with people. So come over and join the conversation, and or you can access
Definitely.
all of my resources and my books and everything online as well.
Yes, thank you so much for your time. And we've really learned so much. And this is the Dr. Lamb Show. We're here to talk about integrative medicine, but also to empower you to take control of your health. So if you like this episode, make sure you share it, and also subscribe for notifications. And stay tuned for next week's episode.